Today, we're diving into the fascinating and crucial fields of maternity and pediatric nursing. This is a specialized area of nursing, a field that shapes the earliest, most vulnerable stages of life, providing care and support during some of life's most significant moments. The scope is vast and incredibly diverse, ranging from the miracle of childbirth to the management of childhood illnesses, encompassing everything in between. Understanding the breadth of knowledge required and preparing thoroughly for exams can understandably feel overwhelming at times. Our goal is to help you navigate this complex landscape, to break down complex topics into manageable, essential concepts. We aim to equip you with the knowledge and skills necessary not only for your exams, but also for your future practice as a competent and confident nurse. We'll start with the mother, focusing on the unique physiological and emotional changes she experiences. We'll delve into labor, delivery, and crucially, what to do when unexpected complications arise, ensuring the safety of both mother and child. You'll learn about essential emergency interventions, the protocols, and the critical thinking required to act swiftly and effectively. We'll also cover cornerstone medications frequently used in obstetric care, understanding their indications, contraindications, and potential side effects. Remember, this isn't just about memorizing facts and figures to pass a test. It's about developing the critical thinking skills and compassionate approach needed to act decisively and compassionately at the bedside, providing the best possible care for your patients. Then, we'll shift our focus to pediatric care, exploring the unique challenges and rewards of working with children. Here, children's unique developmental stages and physiological differences require specialized skills and a deep understanding of their specific needs. We'll cover common respiratory emergencies in children, such as bronchiolitis and asthma exacerbations. We'll also discuss congenital heart defects and other common pediatric conditions you're likely to encounter in your practice. You'll learn to recognize subtle but critical warning signs that indicate a child is in distress. You'll also learn how to intervene effectively using evidence-based practices to ensure the best possible outcomes for your young patients. We'll also touch on the importance of proper nutrition for growth and development, identifying and addressing developmental delays. And finally, we'll discuss the crucial role you play in safeguarding children from abuse or neglect, creating a safe and supportive environment for their well-being. Remember, as a nurse, you're not just a caregiver. You're also a vital advocate for your patients and their families. Your keen observation skills and unwavering vigilance can truly make all the difference in a patient's life. Consider this guide your trusted study companion, providing you with the tools and resources you need to succeed. It's designed to build not only your knowledge base, but also your confidence and competence as a future nurse. So, prepare not just for the immediate challenge of exams, but for the long-term rewards of a fulfilling and impactful nursing career, where you can make a real difference in the lives of others. Let's get started on this exciting journey together. Your path to becoming a skilled and compassionate maternity and pediatric nurse begins now. Childbirth unfolds in 4 distinct stages, a remarkable journey of life. Each stage presents unique nursing priorities, demanding a tailored approach to care. Understanding these priorities is crucial for ensuring a safe and positive birthing experience. The first stage, latent, characterized by early, often mild contractions, active, where contractions become stronger and more frequent, and the transition phase, the most intense part of labor, begins with those initial mild contractions and culminates with full cervical dilation, marking the readiness for delivery. Early on, your focus is on providing comfort, offering reassurance, and creating a supportive environment. Hydration is key, ensuring the mother remains well-nourished and energized throughout the process. Continuous monitoring of vital signs and the fetal heart rate provides crucial insights into the well-being of both mother and baby. As labor intensifies, you'll support pain management strategies, whether through medication or non-pharmacological methods. Regular assessment of maternal and fetal well-being is paramount, allowing for timely intervention if needed. During the transition phase, provide firm coaching, guiding the mother through the most challenging contractions. Simultaneously, prepare the delivery room, ensuring all necessary equipment is readily available. The second stage is pushing, the active effort to deliver the baby. Guide the mother through effective pushing techniques, carefully monitor fetal descent, and remain vigilant for any signs of fetal distress requiring immediate action. The third stage involves delivering the placenta, a crucial step in completing the birthing process. Closely monitor for excessive bleeding, a potential complication that requires prompt intervention. The fourth stage, the immediate postpartum period, is a time for careful observation and support. Prevent postpartum hemorrhage through uterine assessment and fundal massage, ensuring the uterus contracts effectively. Promote bonding between mother and baby, facilitating that crucial initial connection. Throughout this entire journey, clear communication with the medical team and vigilant monitoring of equipment are absolutely key to a successful outcome. Your role adapts seamlessly with each stage, requiring flexibility and a deep understanding of the birthing process. Ultimately, your goal is ensuring the safety and well-being of both mother and baby, a responsibility you carry with dedication. Mastering these stages thoroughly prepares you for the real-world challenges of maternity nursing. From providing simple comfort measures to implementing critical emergency interventions, your skills will be constantly tested. Your decisive actions and quick thinking can make all the difference in a life-changing moment. This roadmap serves as your foundational guide for providing safe and effective maternity care, building confidence and competence. Now, let's move on to exploring potential complications and the critical interventions required to address them effectively. Always stay alert. The course of labor can change in an instant, demanding your unwavering attention and expertise. Even with preparation, labor can present sudden challenges. Uterine dystocia, abnormal or prolonged labor, requires assessment and interventions like position changes or oxytocin. Placental abruption is a medical emergency. Look for sudden pain, rigid abdomen, and bleeding. Act fast. Notify the provider, start IVs, and prepare for possible cesarean. Placenta previa presents as painless, bright red bleeding. Never perform a vaginal exam. Focus on monitoring and prepare for C-section if bleeding is severe. Cesarean sections are necessary for complications like fetal distress or cephalopelvic disproportion. Obtain consent, start IVs, provide support. Post-op manage pain, monitor incision and bleeding, encourage early movement. Diligent nursing care is vital for safe recovery after C-section. Recognize complications early. Your actions save lives. Let's review fetal monitoring and essential medications. Monitoring fetal heart rate is crucial during labor. A normal pattern, 110-160 BPM, moderate variability, and accelerations, signs of fetal well-being. Early decelerations mirror contractions and are usually benign. Late decelerations signal uteroplacental insufficiency. Act fast, left side, IV fluids, oxygen, notify provider, stop oxytocin if needed. Variable decelerations suggest cord compression. Change maternal position. Key medications: oxytocin induces labor, risk of tachisystole; opioids for pain relief, risk of respiratory depression; epidural, risk of hypertension. Your job: administer safely, monitor for side effects, and intervene if complications arise. Fetal monitoring and medication management are at the heart of safe labor care. Next, let's tackle neonatal emergencies. The first moments after birth are critical. Emergencies can arise fast. Shoulder dystocia, baby's shoulder stuck after head delivery. Call for help. Assist with McRoberts maneuver, never apply fundal pressure. Communicate with the mother, monitor time, and prepare for neonatal resuscitation. After delivery, assess for injuries and maternal complications. Watch for respiratory distress, grunting, nasal flaring, retractions. Suction, stimulate, and provide oxygen as needed. Prevent hypoglycemia, encourage early feeding, monitor glucose. Your vigilance ensures a safe transition for newborns. Now, let's move to pediatric emergencies. Pediatric respiratory emergencies are common occurrences in healthcare settings. They require a calm and collected approach and can escalate quickly, sometimes within minutes. Therefore, a rapid assessment and intervention are crucial. Epiglottitis, a serious infection that can obstruct the airway. Sudden fever, often high and unyielding. Drooling due to the pain and difficulty swallowing. Tripod position, an attempt to open the airway. Never use a tongue depressor, as it can trigger a complete airway obstruction. Keep child calm, reducing anxiety and respiratory effort. Prepare for intubation, as this may be the only way to secure the airway. Post-tonsillectomy bleeding, a potential complication requiring immediate attention. Watch for frequent swallowing, a subtle sign that blood is trickling down the throat. Restlessness, indicating hypovolemia or anxiety. Or vomiting blood, which is a more obvious sign of hemorrhage. Notify surgeon immediately to determine the next course of action. Keep child NPO to prevent further vomiting and potential aspiration. Position on side to protect the airway if vomiting occurs. Congenital heart defects. Structural abnormalities present at birth. Ventricular septal defect, a hole in the wall separating the ventricles. Too much blood to lungs, leading to pulmonary hypertension and heart failure. Signs of heart failure such as rapid breathing, poor feeding, and edema. Tetralogy of Fallot, a combination of 4 heart defects. Cyanosis, a bluish discoloration of the skin due to low oxygen levels. TET spells, sudden episodes of severe cyanosis and respiratory distress. For VSD, treatment focuses on managing symptoms. Manage with diuretics to reduce fluid overload in the lungs. Digoxin to improve heart muscle contractility. Monitor for toxicity, as digoxin has a narrow therapeutic window. For tetralogy, immediate interventions are crucial during hypercyanotic spells. Knee-chest position during TET spells to increase systemic vascular resistance. Give oxygen to increase oxygen saturation. Calm the child to reduce oxygen demand. Surgery is often needed to correct the underlying defects. Your role is symptom management and family education, empowering families to care for their child at home. Quick recognition and intervention are paramount in these critical situations, are life-saving in pediatric emergencies, improving outcomes and quality of life. Let's cover hematology, the study of blood and blood disorders, musculoskeletal health, focusing on bones, joints, and muscles, and child safeguarding, ensuring the safety and well-being of every child. Stay alert. Vigilance is key in pediatric care. Children's conditions can change rapidly, requiring constant monitoring and reassessment. Your expertise makes a difference in the lives of these vulnerable patients. Pediatric hematology demands swift, skilled care. Sickle cell crisis. Manage with hydration, oxygen, pain relief, HOP. Hemophilia, prevent injury, give clotting factor for bleeding, use rice for joint bleeds, educate families. Developmental dysplasia of the hip. Assess for asymmetry, use Pavlik harness, teach parents proper care. Nutrition, promote breastfeeding, safe formula prep, introduce solids at 6 months. Monitor developmental milestones at every visit. Be vigilant for abuse or neglect, unexplained injuries, poor hygiene, failure to thrive. Report any suspicion. Your duty is to protect. Your observation and action can be a child's lifeline. With these skills, you're ready for both exams and real-world nursing. Thank you for your commitment to care.